Imagine this for a moment. It's a quiet Tuesday morning. You pour your coffee, you walk to the mailbox in your slippers just like you've done 1,000 times before. And there it is, a thick white envelope from your Medicare Advantage plan. You open it at the kitchen table, and your stomach drops. We regret to inform you that your plan will no longer be offered in your area for 2026. Your hands start to shake. You've been on this plan for 7 years. Your doctor is on it. Your wife's cardiologist is on it. Your prescriptions are covered, and now it's gone. You sit down. You whisper to yourself, what do I do now? Where do I go? Will I lose my doctor? Can I even afford the new prices? If this scene feels too close to home, if you've already received a letter like this, or if you're terrified one is coming, please take a deep breath. You are not alone. Right now, across America, millions of seniors are facing the exact same fear. I'm Georgia, a senior policy analyst, and you're watching Pension Pulse. In the next few minutes, I'm going to walk you through, in plain English, exactly what's changing in Medicare for 2026. I'll show you the new Part B premium, the new Part D drug cap, the truth about Medicare Advantage plan cancellations, and the legal rights you have that most seniors don't even know exist. But please, stay with me until the very end, because there is one hidden mistake, one tiny oversight, that is causing seniors to lose their coverage, lose their doctors, and pay thousands more out of pocket. I will reveal that mistake near the end of this video, so don't click away. Let me first tell you about Robert. Robert is 67 years old. He retired 3 years ago from a manufacturing job in Ohio. He worked hard his whole life, paid his taxes, followed every rule. When Robert turned 65, he signed up for a Medicare Advantage plan because it had a $0 premium, free dental, and a small grocery allowance. It felt like a gift. For 2 years, everything was perfect. Then, in October of 2025, Robert got a letter in the mail. It was called the Annual Notice of Change. Robert glanced at it. He thought, "Oh, this is just paperwork. My plan is fine." He set it aside on the counter next to a stack of grocery coupons, and he forgot about it. That one decision, that one moment of, "I'll read it later," cost Robert dearly. Because buried in that letter was the news that his plan was eliminating its over-the-counter benefit. His monthly premium was going from $0 to $35. His Part D drug premium was jumping from $93 to $119. And worst of all, his primary care doctor of 15 years was being dropped from the network. By the time Robert realized what happened, it was February. The open enrollment window had closed on December 7th. He was stuck in a plan he no longer wanted, paying more, getting less, and losing his doctor. Robert's story is happening to millions of seniors right now. So let me make sure it does not happen to you. Let me explain what is actually changing in 2026, straight from Medicare.gov and the official Medicare You 2026 Handbook. First, Part B. The standard Medicare Part B premium for 2026 is now $202.90 per month. That is up from $185 in 2025. The annual deductible has also climbed to $283 before original Medicare begins paying anything. For many seniors living on a fixed income, that extra $18 a month feels like a punch in the gut. Because remember, this is taken directly out of your Social Security check before you ever see it. Now Part D. Here is some good news mixed with the bad. In 2026, your out-of-pocket spending on covered prescription drugs is capped at $2,100 for the entire year. Once you hit that cap, you pay $0 for your covered medications for the rest of the calendar year. This is a real protection, especially for seniors taking expensive drugs, for cancer, diabetes, or heart conditions. And there's a new program called the Medicare Prescription Payment Plan. It lets you spread that $2,100 across monthly payments instead of paying it all at the pharmacy counter. It is free to opt in, but you have to ask for it. Nobody is going to enroll you automatically. Now let's talk about IRMAA. This stands for the income-related monthly adjustment amount. And this is where so many retirees get blindsided. If your income from 2 years ago, that's your 2024 tax return, was above $103,000 as a single filer or $206,000 as a married couple filing jointly, you will pay extra on top of your Part B and Part D premiums in 2026. At the highest tier, IRMAA can add over $440 per month to your Part B premium alone. Here's the cruel part. Maybe in 2024 you sold a piece of property, or you did a Roth conversion, or you cashed out a CD. That one-time bump in income, it is now hitting your Medicare premiums in 2026, 2 years later, and many seniors have no idea why their Social Security check suddenly got smaller. Now let's talk about the big one, the Medicare Advantage plan cancellations. According to the Kaiser Family Foundation and AARP, going into 2026, insurance companies are terminating, scaling back, or non-renewing Medicare Advantage plans across the country. Aetna, United Healthcare, Humana, Blue Cross, many of them have pulled plans from entire counties. If you receive that termination letter, you have a special enrollment period. Per Medicare.gov, when your plan ends or does not renew its contract, your special enrollment period runs from December 8th through the last day of February of the following year. That is your window to pick a new plan. But here is where the trap is set. Many seniors think, well, I'll just go back to original Medicare and buy a Medigap supplement policy. And they assume any insurance company has to sell them one. That is not true. Under federal law, your guaranteed issue right to buy a Medigap policy without medical underwriting is very limited. Outside of your initial 6-month Medigap open enrollment period when you first turned 65, insurance companies in most states can deny you, charge you more, or refuse to cover pre-existing conditions. There are only a few situations where you have guaranteed issue. 1, your Medicare Advantage plan is leaving your service area. 2, you lost employer or union coverage. 3, you are within a 12-month trial right after first joining a Medicare Advantage plan at 65. A handful of states, New York, Connecticut, Massachusetts, and Maine, offer broader year-round protections. But for most of America, if you have a heart condition, diabetes, or cancer history, and you try to buy a Medigap policy outside of these narrow windows, you can be denied. Period. That is the trap. That is the heartbreak so many seniors are walking into right now without knowing it. So please, listen carefully. Here are the 3 exact actions you need to take, starting today. Step 1. Read every single piece of mail from Medicare and from your insurance plan, especially the annual notice of change that arrives every September or October. Do not set it aside. Do not assume it is the same as last year. Sit down at the kitchen table with a pen and read it line by line. Look for changes to your premium, your deductible, your drug list, and your provider network. Step 2. If your plan is being terminated, or if you want to switch, contact your State Health Insurance Assistance Program, also known as SHIP. This is a free, unbiased counseling service backed by federal funding. They will sit with you, look at your medications, look at your doctors, and help you compare plans. Their phone number is in the back of your Medicare and You Handbook. You can also call 1-800-MEDICARE directly. Step 3. If your income dropped because you retired, lost a spouse, or had a major life change, file Form SSA 44 with the Social Security Administration. This is the IRMAA appeal form. It can lower or eliminate that high income surcharge on your Part B and Part D premiums. Most seniors have never even heard of this form, but it can save you thousands of dollars a year. The form is free at ssa.gov. And now, the hidden mistake I promised you at the beginning. Here it is. The biggest mistake seniors are making in 2026 is assuming that if their Medicare Advantage plan disappears, they can simply walk into any insurance office and get a Medigap supplement to fill the gap. They cannot. If you wait too long, If you miss your special enrollment period, if you let that window between December 8th and the end of February slip by, you can be left with original Medicare and no supplement. That means you face a 20% coinsurance on every doctor visit, every test, every surgery, with no out-of-pocket maximum. A single hospital stay could cost you tens of thousands of dollars. So mark your calendar, set a reminder on your phone. Tell your spouse, your son, your daughter. October 15th through December 7th is your main open enrollment window every single year. And if your plan terminates, you have until the end of February to act. Now listen to me carefully because this is important. YouTube notifications are not reliable. The platform changes its algorithm constantly. You may not see my next video when a new Medicare rule, a Social Security change, or a banking regulation drops. And in retirement, missing an alert can cost you real money. That's why I want you to click the link in the description right now and join our global Senior Alerts official WhatsApp channel. The moment you join, you will receive a free download of our Senior Benefits Protection Guide. It walks you through every Medicare deadline, every Social Security form, every IRMAA appeal step, and every banking and insurance protection you need to know about in 2026. You will also get real-time alerts directly to your phone whenever there is a change to Social Security, pension rules, Medicare, banking regulations, or travel rules for seniors. No algorithm, no middleman, straight to you. You worked your entire life for these benefits. You paid into this system through every paycheck, every tax return, every year of hard work. You deserve to keep what you earned, and you deserve to understand the rules that protect you. I'm Georgia with Pension Pulse. Stay informed, stay protected, and I will see you in the next video.